Hi, welcome to day number 24 of the 30-day practice blueprint. Yesterday, we talked a little bit about orthotics. I gave you kind of my best tips for orthotics. And I would love to know, because if I could fix, I always like to look at like, what are the big doors that are moved by little hinges, right? That's not my quote, but like in terms of my office, if I could do one thing all day long, it would be orthotics, it would be shockwave, it would do braces, it would be in-office procedures. That's what I like the most. And so if you guys have things that really make orthotics well for you, easy for you, sales techniques, different ways of explaining it to patients, things like that. I would love to know what you do. I think the more knowledge we have and we can share with one another, the better we're all going to get back at it. Okay. So today I'm going to share some of my 80-20 techniques with x-rays. I don't know if everyone does x-rays in their office. I would certainly hope by this stage you would have digital x-rays. We have two systems. We have one in our Worcester office and one of our Westward office. And one of the kind of the challenges, we have two systems. And so depending on where I'm at, I have to bring up one browser or the other, but all of them are stored on the kind of on the cloud, and they're each in that system. It's kind of a cool system, so I can get it no matter what office I'm at. So if I'm in the Worcester or Westboro, I can see the images from both. That's really helpful. And then we also have ultrasound. So those are the two things that we use a lot. We also order like MRIs and other types of things, and we have a way that we can, within our medical record, we can kind of look at the MRI reports and things like that. So it makes it a lot easier. It'll actually pull up, we use Shields where we're at, it'll pull up the MRIs within our medical record. So it just makes it a lot easier. So you don't have to spend time looking at it. But my favorite tip in terms of x-rays, right, is all of the x-rays are done before I see the patient. So we have trained our staff. They know what they need to get x-rays for. They know what views to get if they need to get 2 views of the heel and then 2 views of the foot, or if they do 3 views of the foot, or if they do of the ankle, they're going to know all that. So we have to train our staff before they even see us. We get these x-rays. Okay. And in terms of like a few tips I didn't really know in the beginning for fracture follow-up, I tend to get x-rays every 2 weeks. Same thing with surgical things. I get x-rays every couple of weeks. If I'm following a Charcot foot closely, I'm doing it every couple of weeks until things stabilize. So I'm doing quite a few x-rays. And then the other really, really great tip is I have a laminated normal x-ray card in every treatment room. So basically what that means is when I see someone, I have this laminated card with an AP and a lateral. And so I show them their x-ray on the screen, and then I show them the normal. And I'm like, okay, this is why your foot isn't normal. In the past, I've used, like, I try to draw lines on them with our x-ray thing where I can draw different lines, but I find it a lot easier just to show them, okay, this is a normal foot, this is your foot, this is where you have metaductus, this is where you have your bunion, this is where you have your talus bunion, this is where you have the arthritis, things like that. So this laminated card, I'll try to, what I'll do is in the download section, I'm going to put basically just some normal x-rays, as more normal as you can get. And then you can just print that off and laminate it. Okay. If I could find a place to laminate it for you, I would. But basically, you just print it, laminate it. I put one in each treatment room. So when I pull up the x-ray, I show them based on their x-ray and then the laminated one. Okay. That's the first great tip, would be using a laminated x-ray card, just of a normal x-ray. Second thing is, I have, when they're looking at the x-rays, I'm pointing out things, and then I have them take a photograph with their cell phone, because everyone likes to kind of look at that. In the past, we used to give them a CD, or we used to print it out. Some people still print it out. I just have them take a picture, and I'll kind of point out what I want them to look at. So that's a really good thing. And then you can reuse some of those, just so you know. So a lot of times what I do is when I'm seeing a patient, I see kind of an interesting fracture or healing of a fracture or Charcot foot, I'll do a screenshot. So there's a little thing in most of your computers where it's called a clipper, depending if you have a Mac or if you have a PC. It's a clipper, and I'll clip it, and then I'll add it to that Google Slides things. I'll show you how I do that. And I just add it in there. And then in the next newsletter, if I'm doing a newsletter, a video, I'll kind of show them that, and I'll kind of walk them through that x-ray. I'll do the same thing with pictures as well. When I'm documenting, a good tip is we take pictures of everything. Like for nail fungus, we document the improvement. For wounds, we document it. So we're always doing these pictures. Now they're de-identified, so you're not going to know who they are. And so I can use them in my newsletters as well. I take these pictures and I can, as I'm making videos, I can use these pictures. And I tend to do it right when I'm seeing the patient, because I'm not going to go remember later on who had a picture that I liked. And so I'll put it right in there right then. So that's the other cool thing for x-rays, would be taking pictures and putting and using them. And then finally, for documentation, when I look at the x-ray, I actually have within my medical record, and this is what we talked about a couple of days ago, I have a documentation thing with my medical record. So I can just say, calcaneal inclination is normal. There's no accessory bones. There's no fractures. And I just go down and just click it, and I type in some stuff. So as I'm reviewing the x-rays with the patient, I'm actually just documenting everything in the chart so that the charting is done. Okay. So it makes it a lot easier when you're looking at x-rays to actually just document at the same time, and getting a good template in your medical records are really going to make that easier. Okay. Now, another thing is, before I show you the x-rays, I'm going to talk about ultrasound. So we use ultrasound quite a bit in our office. In Massachusetts, it's not always covered by insurances. Some insurances cover it, like Medicare, others don't cover it. Some say that we're not qualified to do it because we haven't done a certain class for it. And so some people just pay cash. So normally, if insurance covers it, great. If they don't, I charge $100 for an ultrasound. And if I do an ultrasound guided injection, I just charge $50. If I'm doing multiple ultrasounds, usually I'll just charge for the first one, but the other ones I'm not charging for. Okay. I also use ultrasound in my presentation. In the beginning, I think it was day 3 for plantar fasciitis. You're going to see in my plantar fascia presentation, I'll show them a picture of an ultrasound. I don't always do that the first visit, but I always prep them for the next visit when I'm going to do the ultrasound. So I do it in the presentation. I'll show you that in a second. Another great tip for ultrasounds is you always do it bilateral. So if you're looking at a plantar fascia, if it's on the right foot, you're going to do it on the left foot. So you can show them, like, the left foot is definitely thickened. It has more effusions, more darkness, hypoechoic, hyperechoic, things like that inside of the ultrasound. And my best tip for ultrasounds is, when you get an ultrasound, get a good one, okay, first, because they're not all created equal, and then do an ultrasound block time. So set up, like, I don't know, Tuesday afternoons, and put all the ultrasounds in that time. Don't try to do it when you're with the patient for their visit. So have them come back for a different time. Do like tons of ultrasounds on patients, and don't even charge them in the beginning, just so you can learn how to do it. Not just do the ultrasound, but also learn your documentation within the ultrasound, because you have to kind of write it on the screen. And so sometimes you can write it, other times you can send it to your PACS system and then write it afterwards. So there's a couple of different ways of doing that. And I usually, when I'm holding my probe, where the little dot is, for me, that's showing anterior, and the other side's posterior, or medial and lateral. So I'm always having the same designation when I'm looking at the ultrasound probe. Okay, you have to get fast at them, and then once again, have the patients take pictures of them. Okay, I do them for also post-treatment. So for example, post-amnio injection, post-shockwave, post other types of things, like just so they can see the before and the after. So it's really, really helpful. Ultrasound, we use that a lot in the office. Okay, so I am going to show you my screen here, just how I use x-rays and things like that in the office here. Okay, so here is my screen. This is that plantar fasciitis. I think in day 3, I gave you guys these slides. And this is what I show with every single patient when they come into the office. I show them this picture, and I kind of show them kind of what's happening here. I say, you might have a spur, but usually spurs aren't the issue with plantar fasciitis. So I'll show them a picture, and I say, we get x-rays the first visit. And then what I do is that I show them the ultrasound, and I say, here's an example of thickness, and here's the other thickness. You can see how it's thicker, it's darker, and that usually means it's more inflamed. And then what I'll do is I'll say, if I'm in a state that they covered it, I would just do it that day, because I've kind of learned how to do it. But if not, I'll have them come back at the follow-up. I say, we're going to start some initial treatments. We're going to start some icing, anti-inflammatories, changing your shoes. And then at the follow-up visit, we're going to do an ultrasound, and we're going to compare one side to the other side. So that's how I use the ultrasound in the office. Now, this one slide has helped me a ton. Okay, this one slide has helped me a ton. Another thing that I do here is I will show you guys this here. This is my actual ultrasound kind of slide to show them. So as I'm doing an ultrasound, I am going to show them like I say, you know, I do ultrasound in a lot of different conditions. Okay, so I just kind of show that to them as well. Here's my little reminder that black is hypoechoic and white is hyperechoic. Just a little reminder here as I'm showing them things. And then if I do like the plantar fascia, this is the same one, but within each of these slides, I actually have normal numbers. Okay, so the normals for Achilles tendonitis, for plantar fasciitis, for things like that. So here's the normal for a male, normal for a female. I measure theirs. I kind of show them the anatomy. I show them that the probe is right here. It's measuring it. Here's the thickness. And so I do this. And then after this slide, I usually include my checklist. And so those are the checklists. I put them all together within my ultrasound slide. So I do this. You can do this for a lot of different things. I have it for, I don't always show these. The main ones I show them are for Achilles tendonitis and plantar fasciitis, but you can see here, you can have it for turf toe. You can do it for like a plantar fibroma. And once again, what I'm doing, and I find some interesting anatomy, I'll just add it to my presentation. Here's for my Achilles tendon with normal numbers. Okay. Here's my Haglund's spur, kind of what it looks like. My sesamoids, kind of looking at flexor hallucis longus and sesamoids, looking at the peroneal tendons. And if you look at the slides on the side, I don't always start with beautiful slides. These are just the ones I kind of put together, and I'm just kind of making them work. Here's ganglion cysts, os trigonum, neuromas, posterior tibial tendon, plantar plate here. So the nice thing is when you guys make your own and you're making your own slide deck, you can just always use this. I think it's better for you guys to make your own. So that is that's how I use ultrasound. I do more of the x-rays this way. I show the ultrasound this way. I have something similar within the presentations on, like, for example, for fractures, I'll show them fractures that are bad or things like that, and how they're healing and other items like that. Post-surgical, I have pictures, x-rays as well, bunions, what they typically look like before and after. And I'll use all those types of x-rays, not just treating them, but also showing them within the presentation. So once again, I hope you guys found this beneficial. Put in the comment section below what things work well for you for x-rays, for ultrasounds, any tips that are really kind of slick that you're using. I would love to hear about those. As well, if you guys found this beneficial, if you haven't sent it to a friend, please do so. Just put their email down there. I'll send them an invite to this course. I hope you're getting good content, and we've covered kind of a lot of things in this last few days. What we're going to talk about tomorrow are non-covered procedures. So the first procedures that we talked about before were the procedures that insurance usually covers. We're going to talk tomorrow about non-covered. Those are the things that people are paying cash for in the office. Okay, guys, thanks.